All right, welcome everybody. This is Rowdy Dad with Rowdy Mom. We got Rowdy Pooch over here, and camera person is Rowdy Sister tonight. So, how's everybody doing? Hope everybody's going good. Tonight we're going to be talking about mental health tips for the parents of children with Dmdd, with other mental health challenges themselves. So I'm going to be very open and honest tonight, and I'm going to be sharing these 10 tips, but I'm going to be very open and honest about my own mental health issues and challenges that I'm facing while taking care of a son with mental health challenges. So you want to say hi, Mom?
How many did you say you had tips?
Yeah, I have 10 tips. So stay for the whole video to get all 10 tips. So I have a mental health diagnoses as well that I deal with. I have a mood disorder, and I have depression and anxiety as well. So I deal with a lot of that going on while also trying to take care of Nicholas. One of the things that we do as parents is, we get, since everybody else blames us for our child's behavior, we start taking that upon ourselves and embracing that and thinking that we're really horrible parents or bad parents for our child being this way. And I just want to say, tip number one is give yourself grace. You'll give other people, go get pumpkin. So give yourself grace that you would afford other people with mental health issues. You would not be mad at yourself, somebody else who's having mental health issues. So give yourself that grace that you would afford to everybody else. You're going to make mistakes as a parent, but that doesn't mean that everything is all lost. You're going to have situations where you get drawn into the rages, and you too act angry or scared, or you're drawn into that same mood as your DMDD child. So give yourself some grace. When you make those mistakes, they're mistakes. It's not the end of the world. You're also going to find that sometimes you're going to be sad.
Go. Go.
So take time for yourself. You want to give yourself some time together as parents.
Yep.
Alone time. Find one of your kids find one of your family members to watch your kids for, even if it's just 30 minutes while you run to the grocery store together. Give yourself some time to yourself. It's very easy to get caught up in the minutia of taking care of your child and trying to find out what the diagnoses are, or being afraid to have any conversations or walking on eggshells as a parent.
And also, I've also talked with different people, and they've been saying different stuff, like some of the stuff like you suggest. What if we don't have family? What if we don't have this? Even when it's time for bed, when the kids are in bed, or just in different situations, once the kids are in bed, find a series and watch it together. I mean, order some McDonald's ice cream when they go to sleep. I mean, I don't know. Do something. Or if that's not the case, if a child is enraged, the parents can take turns if that's what happens. It shouldn't be that one parent is dealing with a child when they're enraged. Or if the child has to be at the hospital, one parent shouldn't have to be there at the hospital. They should take turns. So I know when some people say, well, I don't have it that easy or something like that. Once the child is asleep, or if the child is at school, or whatever the case is, allow each other to have that time. So,
and we do have, if you'll contact us via email or text message or messenger, WhatsApp, you can contact us. We do have some resources if you're in the state of Oklahoma, resources where you can get some respite care. There are some organizations, so you can contact us. We'll share that information with you, and you get respite vouchers or get a babysitter for the evening. And the thing about those are that those people are trained with these children. So we've got some resources. Reach out to us. We've got some resources for you. So number one is give yourself some grace. Number two is take time for yourself. Number three, remember that your child is struggling. Not purposefully being spiteful, not purposefully being angry. They can't take these are things going on within them. And so, understand that they are struggling. And once you're able to reframe it that way, I think that's better for your overall mental health. If you think that your child is just being defiant because they want to be defiant, no child chooses to live in this amount of anger. No child chooses to be this hurt and acting out and in this way. So if you realize that they're struggling, that will make your thoughts easier to deal with. Stay grounded. So sometimes you get drawn into those situations where your anxiety is high, your depression is high, and you start to think, negative thoughts about yourself as a parent or as a person, So some way when you're having those thoughts, you can ground yourself. A couple of grounding techniques: splashing cold water on your face, holding ice in your hands. One that I really love to do, and I don't get to do it as often as I'd like to, is just take off your shoes, take off your socks, and walk in the grass and feel the grass and the ground on your feet. It'll bring you back and recenter you and help you reframe your thoughts and bring you back to grounded. So you want to stay grounded, and that's what we talk about with grounding techniques, different things that are able to take your mind off of the situation for just a few moments, and then you're not in that same mind frame, and your mind has switched gears onto something else. So definitely take and use the grounding techniques. We talk about reframing your thoughts. So with me, I went through a mental health crisis, not this past February, but February before last in 2021. So I had a mental health crisis, and I took some time, and I spent about 14 days in a hospital and then 21 days in a very intensive outpatient program. And one of the things that we talked about is CBT therapy. So remember, we're on number 5 right now. Reframe your thoughts, and you can use CBT triangles. And what you start thinking about is what the thought leads to behaviors, and the truth of that. So, you can write this down instead of saying I'm a horrible parent. Write it down on a card. The reasons that is not true. So I'm not a horrible parent because I take care of my kids, because I work every day for my kids. Whatever it is for you, reframe it for you so that you can get that thought and reframed into a more positive from a negative. Mm-hmm. This is one that's really hard. I have pretty severe depression when I'm not taking my medications, and it's real. When you have self-esteem issues already, you understand that DMDD kids will say things to you like they hate you, they wish you weren't their dad, I want to kill you, I want to kill everybody that you've ever loved. Those words are hurtful, coming from a child who you love with every fiber in your being, and everything you are doing is to help this child and to find out the diagnoses, find the help, get the help for him, and you're doing that. And it just, when the child says those things, it can be very hurtful. So it's really hard not to take it personal. So number 6 is don't take it personal. When your child is being verbally abusive or physically abusive, it's not anything that you've done, and it's not anything that your child can help. So
also in those situations too, you can't, I know it, when you're in that rage, I know it's so hard to try to put like some positivity into it, but in some of those cases when your child is in rage, you can also get upset. But try and remember, instead of trying to say something back to them, it can just, I love you too, you are special, I still love you. And I know it probably sounds crazy to some people, but when a child is truly in rage, once they come out of that rage, now they're afraid, they're ashamed. Like some days when,
and they quite often they don't know what's going on, but they see what's happened around them, and they know that they must have done it, and that is very time consuming for them, and very it causes them to be very, they spend a lot of time in that, so in that state of mind. So number 7 is don't engage, walk away. So what that means is, as much as you would rather go in there and scream and yell at this child who is tearing up their room,
or your front room,
or your front room, or your garage,
or your car,
engaging them will only make it worse for both you and them. It's going to cause you to say things that you may not mean, out of rage and retaliation for what they're saying. You could get into the reach of them actually abusing you physically, get too close. But don't engage, walk away is a self protection. And just remember, self-care is not selfish. As much as we think about self-care and doing things for ourselves, that's why these 10 tips are very, very important to me and to our family, and we practice these things. And again, these are things that I learned through this, but also because I'm dealing with the mental challenges as well, mental health challenges. So this is Mental Health Awareness Month, and we're winding it down. So we need to bring more tips to you guys and finish strong with the month of May. So don't engage, walk away. That's good for your mental health because you're thinking ahead. You've got the impulse control while the child does not have the impulse control. So think ahead, don't engage, walk away. They want nothing more than you to engage them sometimes. As Dr. Fisher said, sometimes they will fake a seizure. So just like a normal epileptic will sometimes fake a seizure to get out of work and to get out of things. So, don't engage, walk away. So sometimes they want you to engage. It's another part of the disease. They want you to engage. They want you because they are feeling so self-worth, so low self-esteem that they want somebody else to be in their misery because they're so sad about what they're doing. Practice your breathing techniques. Breathe in for a count of 4 and breathe out for a count of 5, and then breathe in for 4 and out for 5. In through the nose, out through the breath, out through the mouth. So practice breathing techniques. Those are another centering, but they can also lower your pulse rate, lower your blood pressure, bring you back down to a state of calm mind. So definitely practice breathing techniques. Number 9, practice 8-second hugs. That's one of my favorites.
Oh yeah.
You know why? Because my love language is touch. But an 8-second hug, usually we just go in and we hug, oh yeah, okay. But an 8-second hug, at that 8-second mark, your body starts to release endorphins. And endorphins, your brain, it's kind of like it's on drugs. It's happy, it's euphoric. It makes your brain very happy when endorphins are released. So I think you'll feel a lot better. It clears the mind. It takes you out of that momentary. Now, I know you can't go up every day at work and hug somebody or, whatever, but
I don't know. At my job, we hug.
But I'll tell you, after I got back from being in the hospital and being in IOP, I was effectively gone for 40 days or so from work, and my boss met me at the door and gave me a hug, and he was going to give me one of those just little, I said, no, hold it for 8 seconds. And he hugged me for 8 seconds. Nothing about that other than that's what I needed because I was nervous coming back to work. But luckily, where I work, it's a family, and they do care for each other and do things like that. Like, Frank's done things for us. So, practice 8-second hugs. They make you feel better, even if I'm, if I'm the one that was depressed. So, we're coming up on number 10. But what do you think about 1 through 9, Mom?
I think they're all nice. Just because, like you said, as a special needs parent, we do feel like we're supposed to go. We're not supposed to be tired. We have to worry about everything for our kids. We don't, there's some days that, it's fine, I don't have to go get a haircut, I don't have to go get my hair done, whatever. But we're going and doing for the kids, and we never give ourselves that time to wind down. So even if it's nothing special, we have made that a routine of ours. Put on a movie. I sometimes want to watch something scary, but that's not always going to work. Play a little Candy Crush, and we're just slowing down. So you have to take that time.
Watching our Facebook reels, watching TikToks.
You can't like have everything so bottled up that you feel like I can't stop and do anything for me. I can't have a time to breathe. And then when something really happens, you get to the point that now you have exploded and it's bad. So you need to take time for yourself. You do need to remember that when your child is enraged, your child is still there. That is still your child. That is still your baby. They are upset. And again, if someone is upset and you getting upset as well, it's not going to make the situation better, because now it's more escalated. So we have to remember, we have to kind of...
Yeah, so let's go back over. Number 1, give yourself grace. Number 2, take time for yourself. Number 3, understand your child is struggling, not purposefully being defiant. Number 4, stay grounded. Do some of those grounding techniques. Splash some cold water on your face. Grab some ice cubes. Run out in the grass. Go place your feet in the green grass.
Go listen to the birds on your porch.
Yeah, it can be as simple as that. Reframe your thoughts. Turn those negative thoughts. Talk to yourself out of why those are not true. Those negative thoughts that says, "Oh, I'm a horrible parent." Talk yourself out of those. Practice that. How to make that into a positive. One of the things that I used to say is, "I'm sorry. I would apologize. I'm sorry for everything." If I accidentally dropped a cup of water on the ground, you would have thought it was the end of the world, because I just held myself to this higher level, and so I'm so sorry, and I learned to reframe that. And what is it now? I thank you for understanding.
Yeah, thank you for understanding.
Thank you for understanding that I'm human.
Yes.
So
I am human too. You're human too? All right.
Yeah.
Number 6.
Don't take it personal when child is verbally or physically abusive. They can't control what's going on in their mind. Don't take that upon yourself when they say they hate you, because I'm going to be honest with you. I get about 150 I love yous a day out of our son now that he's been on the protocol. And then I get probably about 3 or 4 bear hugs a day, and I think, can I have a hug? Can I have a hug? So when they're in that rage, They're not. It's an emotional seizure. They're not in control. Number 7, don't engage, walk away. Some people say this is picking your battles, and is another way to say that. But I think don't engage, walk away says so much more, because we're not supposed to engage with our DMD, our DMDD kids. Everything tells you, get small, put your hands forward, back away. Everything is a threat. Everything is a threat. So you try to make yourself not look like a threat. And we've used that, and it's worked. And you know what? They can self-regulate once the threat is away from them. And you are the threat at that point in time. Whatever it was that triggered this seizure, you are the threat. So engaging is going to lead to hurt feelings on yourself. It's going to upset you. It's going to get your blood pressure high. So don't engage. Walk away. That's with a DMDD child. That's the best thing to do for your own mental health. Does that mean go off, down the street? No. But if you need to take a walk, take a walk. But don't engage, walk away. Number 8, practice our breathing. It's a way to bring us back to center. Number 9, practice 8-second hugs.
You want to give me a hug?
8-second hugs.
Oh, you feel better now, don't you?
All right, are we ready for number 10? Number 10, we've done the countdown. Take your own meds. Take your own meds.
Take your meds.
Take them on time, within an hour of when you normally take them, plus or minus. Take them on time. It's very important that if you're on medications, that you stay on your medications so that you're healthy for your own family and yourself. So if you're taking anxiety pills, please take your anxiety pills. If you're taking antidepressants, take your meds. Take all of your meds at the times that you're supposed to, so that you can stay healthy. It's not going to be good for anybody if you get off of your meds and you're not able to take care of your family and take care of yourself. All of this tonight is really about one thing. An empty pitcher can't fill any glasses of water. And so if you're that pitcher and you're pouring out and pouring out and pouring into everybody else in your family and your coworkers, and you're pouring into them, your pitcher's going to be empty. And you can't fill any more glasses. You're not going to be able to take care of your family. So an empty pitcher fills no glasses. That's what all this is about. You've got to take care of me so that you can take care of them. So you've got to take care of yourself first before you can take care of them, because you can't keep going the way you're going and doing everything for everybody and pouring it into them, because it will push you to a limit and it can trigger your own depression, your own things. So be cognizant of that. That's really what we wanted to talk about. So the 10 tips we've covered, and we're pretty happy to share that with you. Yeah. For those that need to discuss any of these things, if you want to discuss these, you can message me.
We message back.
We do message Matt. I will personally answer these. Yes. I mean, if you're having an issue, mental health crisis of your own that you need to talk to somebody, reach out to us. We have a WhatsApp. We have our messenger.
No, that's not. Yes, just the messengers. Again, we message back. We get the notifications like instantly. So if there really is, and sometimes we just need that person just to tell us that it's okay.
Yeah.
We're doing okay. We're doing a good job.
Yeah. So, all right, guys. Thank you very much. Thanks for listening to me. I appreciate it. Upcoming news, we're not going to be doing a video on Sunday. We're thinking of moving the Sunday video time to Fridays or to Thursdays. We're not sure yet, but that's some exciting news, I guess, because we've reached a lot of people with this message. So, all right, guys. Just remember, it's okay to be rowdy.